what are some of those data points connected to this piece that healthcare leaders should track to then in turn make those informed decisions, informed hiring decisions?
Yeah, we definitely want to look at volumes and align those staffing ratios with the number of FTEs that are required to hit those volumes. I'll note that from the private practice perspective, particularly in anesthesia, locums can be treacherous in that financially there's likely 9 times out of 10 the case is not actually going to support the cost of the locum. So these are conversations that practices need to have with their health system partner, because while it may not make sense financially for the practice, it may make sense for the system itself, right? We go back to this concept of throughput for the system and the bottom line for a surgical services program. And so while the professional component of the locum billing may not justify cost in and of itself, when you look at the technical component, what that brings to the facility, what it brings to the care in the community, it is worth it. So it's a nuanced conversation. It's not necessarily black and white of, do I make money on this case? Because the answer may be no, and you still may be well suited to do it.
Garth, wanted to come to you here on this as well. I saw you nod your head specifically on the treacherous piece. It can be treacherous. Would love for you to elaborate on this too.
Yeah, I think there's a certain level of comfort with a permanent provider, and Phil said it. They're a known quantity, right? The care team specifically understand their capabilities and know how they work. Introducing a new variable into that equation can sometimes feel daunting. And so, again, I think the approach is partnering with the practice, the hospital, or an agency to find out what that balance really should be in order to really understand how we can facilitate the best possible outcomes, not only for the practice, but for the patients and for the health system at large. So communication is critical in that regard, but there certainly is an underlying motivation or sense of urgency to be able to fulfill the healthcare needs of the constituency at large and do so in a financially acceptable way. And there's multiple ways to look at that, but ultimately is, how do we serve the needs of our patients? We need to have physicians to be able to do that, and how best do we balance that?